Hey Megan, how's your day going so far?
Hi, Luke. It's going all right, thanks. A little slow, you know? I was actually just about to run to the pharmacy.
Oh, the pharmacy. Is everything okay?
Yeah, everything's fine, don't worry. It's just my husband. He has a little headache, and I think we need more, the stuff for a small cut.
Ah, band-aids.
Yes, band aids, thank you. I always forget that word. We used the last one yesterday, so I need to buy more. It's just a quick trip.
I know how that goes. I was at the pharmacy just last week. My daughter had a little fever and I needed to get some medicine. It can be a little confusing sometimes, you know? All the boxes look the same.
Oh, tell me about it. That's exactly why I wanted to chat. I sometimes get nervous. What if I say the wrong thing? What if I buy the wrong medicine?
Totally normal. But it's really easy once you know a few simple phrases. Want to practice a little? Like pretend I'm the person who works at the pharmacy?
That would be so helpful, Luke. Yes, please. Okay, let me think. So I walk in.
Hello, welcome. How can I help you today?
Hi, I need something for a headache for my husband.
Good. That's perfect. Clear and simple. I need something for a headache. Now, I might ask you a question. What kind of pain is it? Is it a bad headache or a small one?
Hmm, it's not too bad, just a small headache.
Okay, so you can say, it's just a mild headache, or it's not too serious.
It's a mild headache. Got it.
Okay, for a mild headache, we have a few options. This one is very good.
And that is.
This is acetaminophen, or some people say paracetamol, but a much more common name is Tylenol. That's the brand name. It's like how we say Kleenex for tissues.
Oh, right. Tylenol. Yes, I know that one. So I can just ask for Tylenol?
Exactly. You can say, do you have Tylenol? Or I'd like some Tylenol, please. They'll show you where it is. Sometimes it's on the shelf. Sometimes you have to ask at the counter.
Okay, Tylenol. And what about for a fever? You said your daughter had a fever.
Right. So for fever, you can also use Tylenol. Or another very common one is ibuprofen. The brand name for that is often Advil or Motrin.
Tylenol, Advil. I think I've seen these. They're for fever and pain, right?
Yes, good. They help with both. So if someone has a headache and a little fever, these are good. But you should always read the box. Always. It tells you how much to take. Or even better, you can ask the pharmacist. They are the experts.
The pharmacist is the person in the white coat?
Yes, usually. You can say, can I speak with the pharmacist, please? They are very nice and they love to help. You can ask them anything. Is this okay for children? My husband has a stomach problem. Is this medicine okay? Things like that.
That's good to know. I always see them, but I never ask. I just look at the boxes for a long time.
Me too. It takes me forever. Okay, so you got the headache medicine. What else did you need?
Band aids for a small cut.
Easy. You can say, where can I find band-aids? Or I need some band-aids, please. They might ask what size, like small ones or big ones.
Small ones, I think, for little cuts on the fingers.
Small band-aids, please. Perfect. You know, another useful thing is antiseptic. It's a liquid to clean a cut.
Oh, yes, we have that at home. It's in a brown bottle. It stings a little.
That's the one. You can ask for antiseptic or rubbing alcohol, or a brand name like Bactine. It's a spray. It's easier to use.
Bactine. Okay, write that down for me, please. So, medicine for headache, band aids, antiseptic spray. I think that's all.
What about a cold if someone has a cough or a sore throat?
Ooh, yes, that's important, especially now. What do I ask for?
Well, a cold is the general sickness. If your throat hurts, that's a sore throat. If you cough a lot, that's a cough.
So I could say, I have a bad cough. What do you recommend?
Exactly. That's a great question. They will show you cough medicine. It often says cough syrup because it's a thick liquid. Sometimes it makes you sleepy, so you have to be careful. You can ask, will this make me sleepy?
Will this make me sleepy? Okay. And for a sore throat?
For a sore throat, you can get throat lozenges. People just call them cough drops. They're little candies that make your throat feel better.
I love those. The honey and lemon ones are my favorite.
See, you know more than you think. Now, let's do a longer practice from the beginning. I'm the pharmacist again.
Okay, I'm ready.
Hi there. Can I help you find something today?
Yes, hello. I need a few things. First, I need something for a headache. It's for my husband. It's a mild headache.
Sure. We have Tylenol and Advil right over here. Which one would you prefer?
Which one is better for a headache?
Both are good. Advil might be better if he has any inflammation, like a sore muscle with the headache. But Tylenol is very good for just the pain.
Let's go with Tylenol, please.
Okay, here you go. Anything else?
Yes, I also need some band aids. Small ones, please.
Aisle 4 on your left. We also have antiseptic spray next to them if you need it.
Yes, that's a good idea. I'll take the spray too. Oh, and one more thing. I'm starting to feel a little scratchy in my throat.
A scratchy throat, that's no fun. We have cough drops here. These ones have honey, or this is a good syrup for a cough and sore throat. It won't make you sleepy.
I'll try the cough drops, please. The honey ones.
Great choice. Is that all for you today?
Yes, I think so. Thank you for your help.
Megan, that was perfect. You did it.
Really? It felt okay?
Better than okay. You were clear, you asked questions. That's exactly what you do. You know, a little story. Last winter, I had a terrible cold. I went to the pharmacy and I completely forgot the word cough. I just stood there and went, I need medicine for this.
No, did you really?
Yes. The pharmacist just smiled and said, for a cough? And I was like, yes, that word. So don't worry. They see it all the time. They want to help.
Oh, that makes me feel much better. So it's okay to use simple words or even point.
Absolutely. Communication is the goal, not perfect grammar. Medicine for headache, band-aids, please, help for cough. It's all good.
What about paying? Do I need to say anything special?
Not really. They will tell you the total. You can pay with card or cash. Sometimes they ask, do you have a rewards card with us? It's a card to save money. You can just say, no, thank you. That's it.
And the medicine is always behind the counter?
Not always. Simple things like Tylenol, Band-Aids, cough drops, they're on the shelves. You can just take them to the cashier. But sometimes stronger medicines are behind the pharmacy counter. Then you have to ask the pharmacist directly.
Okay, so just to remember, my list Tylenol or Advil for pain and fever, cough drops or cough syrup for a cold, band aids and antiseptic for a cut.
You got it. You are now a pharmacy expert.
Thanks to you. This was so helpful, Luke, really. I feel less nervous. I'm going to go now, actually, before my husband's headache gets worse.
Of course. Good luck. I hope he feels better soon.
Thanks. And if you ever need to practice going to the place where you fix your car, let me know. I know a lot about that.
The mechanic? I might take you up on that. My car is making a funny noise. Have a good day, Megan.
You too, Luke. Bye.
Thanks for watching. For more amazing content, and subscribe to Fluent Fusion English.